what we're seeing, especially on the eastern seaboard, is that these Canadian wildfires, and because of just wind currents, are having significant impacts on people's ability to be outside for any period of time. Even a few minutes can cause somebody that might have underlying lung disease to have an exacerbation. Even if you're otherwise healthy, this can cause reactions. So this is impacting everybody. We know that air pollution in all its forms causes fine particulate matter, soot, for lack of a better way to say it, to be released into the atmosphere. And then those particles lodge into the deepest crevices, the smallest arteries in our vital organs, our heart, our lungs, our brain, our kidneys, and it causes organ dysfunction because it causes inflammation within those organs. And I would say 10 years ago, we didn't really think about air pollution as a serious risk factor for chronic disease. Now we do. Now we realize that air pollution actually can cause serious impacts over the longer term, and that is really the concern here.
Yeah, I started with the guy on the right.
A few months of exposure to poor air quality during wildfire season can accelerate aging. It can increase the risk of cognitive decline and early onset dementia. For pregnant women, we know that there's an impact to their uh, baby's developing immune system, and that can last and persist for years after birth. And in addition to preterm birth and intrauterine growth retardation, IUGR. The impacts here are far deeper and broader than I think we initially appreciated, say in the early 2010s. And now, as we're studying this issue a lot more, air pollution is in some ways very similar to the breadth and depth of impacts of smoking cigarettes on the human body. We know cigarettes is a different mechanism, of course, but cigarette smoke doesn't just impact the lungs, it impacts every part of the human body, and it does so in a devastating way. I highly recommend that everybody invest in a supply, and hopefully your employer can provide this, of N95 masks, which are not perfect. We know these masks, of course, from the pandemic, but they can be helpful in filtering out many elements of bad air. Again, not perfect when it comes to wildfire smoke, but it's better than nothing. every single summer, in my opinion, feels like it's worse than the prior summer. 10, 15 years ago, we didn't used to have these conversations. Now we're having them multiple times in a year, well into the fall. And that worries me, number one, that there's just much more exposure over a greater part of the year than typically even 10 years ago. And that two, we're seeing a compounding effect where multiple risk factors are compounding onto each other to really be deleterious to human health.